Hi, my name is Newton Cheng. I'm a husband and father, competitive athlete, and I'm director of health and performance at Google, where I've been for over 15 years. In November 2021, I was scheduled to give a keynote at a Google Health and Wellbeing conference to an audience full of thought leaders and industry experts. This was a huge moment for my career. And so I practiced and I polished that talk because it had to be perfect. As the talk approached, things started to feel off. Like I knew something was wrong with my message. My plan was to talk about the intersections of Google technology and health and well-being. But then 3 days before the event, I couldn't deny it any longer, and I knew I had to throw the entire thing out. And instead, I got up and told people what was really going on. That I had long been suffering with depression and anxiety. I'd soon be going out on mental health leave. And the reason I was telling everyone this is because if we were going to position ourselves as leaders of the field of health and well-being, this is what we needed to talk about. Now, by this time, I had over 2 decades of experience in the field of health and well-being, and via my journey to becoming a world champion competitive powerlifter, I had this really unique expertise at the intersection of health and well-being and human performance. And despite all of that, I still burned out. And the reason I got to a bad place is I was struggling for so long that I was ashamed of how I was showing up as a husband and father. And I was terrified of hurting those that I loved most. Going on leave was an act of desperation because I didn't know what else to do. In May 2022, I returned to work in a better place. But more importantly, I returned with a determination to tell my story wherever I was invited to do so, to pierce the stigma around mental health because I knew how many others were suffering just like me. That was almost 2 years ago. And since then, my speaking schedule has been booked out with workshops, talks, podcasts, because there is such a hunger to have these vulnerable conversations around mental health, especially in the workplace, out in the open. So I'm going to keep telling my story wherever I'm invited to do so.